at times I've got this question in my inbox, people asking if it is possible for someone to switch from being a healthcare assistant to, becoming a registered nurse in the UK. I've got the question severally in my comment section. And today, instead of treating this on my own, I've decided to bring in someone who had passed through this journey. She was formerly a healthcare assistant and recently became a registered UK nurse. So she is here to share her experience, her journey, how she was able to transition from HCA to a registered UK nurse. Yes, can we have you, our guest?
My name is Ngo. I'm an Ngo series here on YouTube as well.
Right, so you are most welcome, Ngo.
Thank
Yes, remember to check her out. She's also based in the UK. She has a YouTube channel. She does content about the UK and lifestyle. So check her out, Ngo Series TV. Yes, so subscribe to her channel and keep coming for more. So Ngo, thank you so much for joining us today. This is just this question I want to provide answer to people who have been concerned about the possibility of switching from being a healthcare assistant to a nurse in the UK. You have gone through this route, So can you tell us, for how long were you a healthcare assistant in the UK?
Okay, thank you so much for having me. I'm so happy to join you on your channel today. Yeah, for your question, I've been an healthcare assistant in the UK for over 8 years.
8 years?
Yes.
Wow.
For over 8
That's
years.
That's a long time. That's a long time.
It's a long time. But the thing is that one doesn't have to be an healthcare assistant for that long.
1 second. Did you, as a healthcare assistant then, did you just work in one place, or you did support work, a carer, hospitals, home support, or was it just in a one home?
No, thank you so much for that question. So for this period of 8 years, I've transited from one arm of healthcare to another. As you know, Chi, there are so many arms of healthcare jobs in the United Kingdom. For instance, I started working as a residential healthcare assistant when So
with the elderly people.
Yes, so residential healthcare assistant is where you take care of the elderly. These people, they are vulnerable. Some of them are okay, they are not sick, but just that they are vulnerable to live in their own home by themselves.
Yes, they need support.
They are no longer with them, and just for someone to be around, they decided to move into a residential home. So residential healthcare assistant. So you just basically look after them. There are cleaners, caterers that that cook their food, and we, the healthcare assistant, we support them with their personal care, hygiene, and stuff like that. So yeah.
Okay. While working as a healthcare assistant in the last 8 years, was the salary something substantial enough? Was it sustainable?
Well, it all depends on lifestyle, to be honest.
Okay.
But as a single young girl, when I started working as an healthcare assistant, I will not say it's something that was really, really flamboyant, but it's something that was able to take care of my needs at those times.
And pay your bills.
Yes, thank you. And pay my bills and keep me going is something that has sustained me for those number of years while I'm working as an healthcare assistant. To be honest, there are still married people that do healthcare assistant work, and there
are a lot of them. There are a lot of them
with children anyway, and they've been able to take care of themselves and their family. It all depends on lifestyle.
So basically, the salary is quite sustainable for everyone. To anyone.
Yes, I would say it is, because not only married women, men as well, they do healthcare work.
Yes.
I will answer yes to your question. Yeah.
Okay. So now, when did you become a nurse in the UK? What year?
I only became a nurse last year.
Last year.
Yes.
That's around August 2022.
Absolutely. Yeah.
Okay. So at what stage as a healthcare assistant did you begin to think about studying to become a nurse?
My nursing journey started when I think it was 2016.
Okay.
that thought, because one thing to become a nurse is just the passion. Caring for people has always been my passion. So when I venture out trying other things, and I still find myself having that strong passion of caring for people. So that was when I said, you know what, I think I have to consider going into nursing. Yeah.
Okay. Going into nursing, how many years did it take you?
3 years in the UK.
3
3 years.
long years. Were
Yes.
you already a graduate in Nigeria or sort of?
Yes. I was a graduate in Nigeria before I came to the UK.
What did you study in Nigeria? Sorry to ask.
I did business management in Nigeria.
Okay, so it's entirely different from health, health setting. So enrolling to become a nurse in the UK, I mean, how did you manage the requirements, the step, having come from a business background as a
Yeah.
graduate in Nigeria, now switching to do nursing in the UK? What requirements did they ask of you?
There are several routes for you to have the requirements to study nursing in the UK, because I'm already in the system here working as an healthcare assistant. That is
Okay,
also one of the requirements, because you have the experience. This country, one of the things they love is experience. So
sure.
yes, so I have the experience, and I did MVQ level 3.
Oh, wait, MVQ, you did level 1, level 2, level 3, or just level 3?
No, I did MVQ level 2 and MVQ level 3.
Okay, that's a higher requirement for working in the healthcare here, especially in health and social care setting. Is a
Yeah,
higher requirement, MVQ.
I will advise MVQ 3, level 2 and level 3 is very, very important when
Oh,
you are in healthcare sector here in the UK. Even if you
okay.
don't have the intention of going into nursing, I think it's one of the courses that I will encourage people to do,
But
because
when people do this, they have this certification, NVQ2 and NVQ3. Do they have their salary increased? Does it boost salary?
not necessarily, but it depending on where you are working. Some people, like, the normal healthcare work start from band 2. If you have
Okay.
3 and you have more experience, that can boost your band to
Promotion,
3. Yes, promotion
band
to,
3.
and when you are band 3, your salary increases as well.
Okay,
So
now I see.
they
So,
contribute.
so having gotten the MVQ3, when
Mm.
you were about registering to study nursing, were you asked for all these O levels or just straight with the MVQ level 3 and the experience you got started?
Yes, you will still require O level. That's our normal GCSE or WAEC. You will still require it. Most importantly, biology, maths, and English, because nursing is all about calculation and human anatomy. So they will definitely require you to have O level, at least I think 5 credits.
Okay, it seems like when you started your nursing program around 2017 or 2016, it
No,
seems by
I didn't
when did you
start.
start?
I said I said I started nursing the idea, but I
Okay,
actually
so
2019.
okay, 2019.
Yeah.
Oh, yes. It seems that around that time, they've not started this, their 2 years nursing with pre-registration that they are doing now. Because if you are switching from a different background now, I think it's 2 years they do. That's nursing with pre-registration masters.
Yes.
So people can as well do nursing for 2 years or 3 years.
So it depending on, like, for example, if you someone that studied say biochemistry, and you want to switch to nursing, you have to do it. It's 2 years. You have to do it. You can switch, but
Yes.
you must have graduated from that biochemistry that you did, and you said, "Oh, I don't want to be a biomedical science anymore. I want to go into."
Yeah.
Yes, you can do that. It's possible.
Okay, just do 2 years. Now I studied mass communication and I
Yes,
want to become a nurse in the UK. I
yes,
think they require 500 working hours from me, as in working in a healthcare setting. You know, I think it's one of the requirements if I'm doing nursing with pre-registration. That's the 2 years program.
I don't know about that 500 working hours. What I know is that they require nothing less than 6 months of experience, but the hours I'm not really
Oh,
sure.
from yes, 6 months. Within 6 months, one should be able to get that 500 working hours in a
Yeah,
healthcare setting.
I believe talent to that. Yeah.
I hope you don't mind me asking you about the fees for the nursing program here. How much did you pay yearly?
So the thing about the fees here is two ways. International students pay differently, and home students pay differently.
Okay.
So for home students, the fee is £9,250 per calendar.
Okay.
International students, when I was studying, it was £11,250.
Not much.
Not so much differences. But the only thing with the home students own is that if you don't have up to that amount, you can loan. They can loan you money, loan you.
Yeah.
Then after you finish, you can start repaying back. But for international students, you have to make them
Hey.
yourself. Yeah.
Okay. How about the placements during your nursing program? You go for placements, I suppose.
Yeah. Thank you
How
so
many?
much. It's
Yeah.
very important. Thank you that you asked this question. Yeah, not
Yes.
split into two. So we have the academic aspect and we have the non-academic, which is the practical aspect. The practical
Okay.
aspect is the most intense aspect. It's very, very intense. So in any nursing, whether it's you are doing general nursing that I did, or you are doing um mental health nursing or child nursing or disability nursing, we all have what is called placement. So placement is where you go actually into the hospital settings to practice what you've been taught in the classroom. So they split it like my university, we split it into two. The amount of time you have in the classroom is the same amount of time you have in the hospital. And they will rotate you from one clinical aspect, one clinical area to another clinical area.
Okay. Different departments.
Yeah, so at the end of your placement, you have different experience combined together.
Okay. Are you because sometimes you guys go for this placement for like 12 hours, 8 hours, 14 hours a day, isn't it?
Yeah,
Were you paid? Do you
good.
get paid for doing placements?
Yeah, thank you for the question. You are really hitting the question at the end. No, the simple answer is no. We don't get paid.
Are you serious?
Honestly, seriously, we don't get paid.
You
But
work and you don't get paid for it.
no. We don't get paid. Before I started, they used to pay, but they scrapped it. They said it was a lot for the government to pay. So they don't pay us a dime, and you work for 12 hours. I think,
Oh my goodness. That would
yes,
be killing. You won't be happy doing the job, to be honest. There should be something.
yes, there should be something. It was only 2020 when Boris Johnson became a prime minister that he pledged to be paying nurses £5,000 per annum. So already
Wait, nurses, you mean
student
the
nurses,
undergraduate nurses in school?
yes. So
Okay.
he brought that scheme 2020, I think after the COVID lockdown.
Mhm.
So then
5,000 a year.
so I received that money for 2 years. Yeah.
Wow.
And
Quite
money,
encouraging.
so it's not much, but at least it's something just to help
Yes.
transport and lunch and all that
Yeah. 5,000 a year.
a year. So they
But
don't
that's good. It's quite motivating than going
that
to do placements and for 12 hours, standing on your feet, running around, helping the patient, and at the end, you get nothing for it.
no,
Oh.
honestly nothing. But the thing is that the 5,000 they don't pay you at once. They split it into three payments.
Mhm.
Yes, so at the
But it's
beginning
still okay, hence they're gonna pay,
they will
you
pay.
know.
In the middle of the year they will pay. Them. At the end of the semester, at the end of the calendar year, they will pay the balance. But at least you're
Okay.
open.
Now, is it really difficult becoming a nurse, especially handling the, needles and chisels and hammers to choke injection? How difficult is that? Because that's my problem with, becoming a nurse.
The simple
Not
answer
my fear.
is difficult. Nursing is difficult. I always say, I'm not saying it to scare any or anybody that is watching this video, but I'm just saying it to get your mind prepared. If nursing is something that you want to do, you have to get your mind prepared. I think even in my channel, I do receive some questions like that, and I think I made a video about that. I don't know if I've uploaded it or not, but I will check.
Okay.
The thing is that it's difficult because you are going to face with all manner of different ailments. You are a nurse, you are there to care for them, whether it's giving them injection or dressing wound or even taking care of people that have passed away. Is all.
Hey, that's the one I was asked to do same in one of the hospitals. One of the days I was doing my support work in the hospital.
Yeah.
So I think a lady passed away, and I was asked to do, what do they call that again? Is it the final thing there? Last minute what?
Last office.
Last office. So I was asked to go do the last office. I said, sorry, sorry, I have not done this before. And meanwhile, I live alone. I was a student there. I said, I live alone. I don't want to be seeing ghosts. So that I will know where to run to at night, you know.
You want
They let me be. They let me be, to be honest. They call someone else to go do the last office.
They are
I was scared. You know,
yes, you are not the only one gone through. You are not the only one that have experienced that. I remember my first time coming across somebody that one of my patients passed away.
Hey.
I was terrified. Then the nurse came. Then I was still an healthcare assistant. He came to ask me. She came to ask me. Say, "Oh, let's go and prepare and give the patient the last office." You know what I did? Honestly, I ran into the toilet and I locked myself for more than 10 minutes.
But now you are no longer running away because you are a registered nurse. You should be doing that.
And I remember locking myself. By the time I came out, they were like, "Where are you?" I said, "Oh, I'm having stomach upset."
Oh my God, that emergency one. Emergency running tummy.
The next time it happened, I was actually with the patient when he passed away. And my husband keeps telling me, it's just human being that you are talking to. The only difference is that they are no longer talking. Just
do it.
Just do it. And that was it. Now
I would cry.
Because it's part of my job. I'm not a nurse. So if my patient pass away, it's my responsibility to go and give the patient the last care. So yeah, that is why I said earlier on that nursing is all about the passion. If you don't have the passion,
it's all about passion.
but I can promise you it's a very rewarding career, honestly.
Sure, it is. Caring for people is rewarding.
Yeah.
You know, so currently, a lot of UK-based nurses, even doctors, though let's talk about nurses, they are fleeing the country, leaving the country to Australia, Canada. You know, you see on the television, newspapers, they have this campaign, rallies, you know, talking about low pay and all them stuff. Do you think that the nurses' salary here is not enough?
Yes, I think it's not enough. I don't blame the nurses that are going elsewhere. The job of a nurse, especially in this country, is very, very intense. I think it's one of the area that the government is not really doing well. That is why you see a lot of nurses. They are going to some places like Australia, Canada, Dubai. Those are the places they pay them very well. But here in the UK, you hear people saying nurses go to food bank to me, which is really sad because
sorry, nurses here, do they now earn up to 30,000 per annum?
No.
Are you kidding me? What's the salary like in a year? Sorry.
Band 5 nurse, we don't earn up to that amount. Now I'm a band 5 nurse. We don't earn up to £30,000 per annum. No, it's not up to. You just have to do like extra shift to make up and cover up. Person like me, I'm not doing.
You guys work a lot. You guys work a lot, to be honest.
The work is a lot. We really, really work now that it's intense. So yeah, I don't blame people that are going, but somebody has to be here to care for people.
Somebody has to do it. Yes. All right. So, what exactly is your advice to anyone intending to become a nurse or to study nursing in the UK or elsewhere?
My advice, first of all, to anyone that is planning to become a nurse is a good career. Nothing is much fulfilling than you knowing fully well that you help someone to get better, you help someone to feel better, you help someone when they are most vulnerable. I know it's a very challenging course, it's a very challenging career, but it's really, really rewarding. And do not be discouraged if you're planning to become a nurse. Do not be discouraged by the job Do not be discouraged by the salary. Just follow your passion, because first of all, it must come from within your heart. It must be,
Yeah.
yes, follow your passion, and at the long run, you will really be happy that you did, because one of the things is that nursing is a long life career. You'll be the one to work.
Sure.
You will get tired. Even when you are old, the job is still there. Even when you are
Sure.
changing country, you don't want to live in the UK anymore. Anywhere you go, it's like nurses are always on demand. So it's one of the career that you will go into and you will not regret. So if you
That's true.
can here in the United Kingdom and you know that you really love caring for people, why not just get what your requirements need? What
And
you
it
need.
doesn't have age limits to start.
No, that is the fantastic thing about nursing in United Kingdom. When I was studying, one of my colleague was almost 60 years and we graduated.
Oh,
Now
you
she's
see.
nurse. That is to tell you that no matter your age, the the career is there for anybody, whether you are old, you're young. The career is open for anyone. It's just your passion. How far are you willing to go? So my advice
Good.
to everyone is that follow your heart. It's not a career that you will regret. It's a career that you will enjoy as long as you live.
All right, guys, you have all heard it from our special guest who was once a healthcare assistant for a
Yeah.
period of 8 years and currently a UK registered nurse. She has shared her experiences, the steps, she's been through for her to become a registered nurse in the UK. And we really appreciate her volume of experience, in this discussion. Thank you so much, Ngo, for coming. Please subscribe to my channel and subscribe to Ngo's series TV on YouTube too, and drop your questions. We would respond to all your questions. If not directly, we'll make a video or videos on them. Thank you once again.
Thank you so much, guys. Thank you. Thank you. Thank
Yeah,
you.
see you again. Bye.
Bye.